Hello, I'm Kleber Meireles. I'm here to speak with you about one topic that is very important. Many doubts about this topic in my classes and in my channel. So, before I start, I'd like you to subscribe to my channel because you're going to see that we're going to be here very often speaking about many important topics and situations in orthodontics. The topic I'm gonna talk about now is open bite, anterior open bite. Many people ask me about the possibility of closing anterior open bite using for that elastics. Yes, it is possible, but it's not about just being possible. It's about is it indicated for this specific case? So I'm gonna show you one series of cases, now just one, treated in different ways with, for example, now elastics. For elastics, yes, it is possible, but we need to understand that before we do this case, in this case, it's possible to do the extrusion of anterior teeth. Why is that? Because you are dealing with the face and patient smile. So if you have the possibility of doing the extrusion of anterior teeth without jeopardizing the beauty of the smile of your patient, it is okay. But it depends on many facts, on many topics that I'm going to explain to you now. In this case, in this specific case, we treated using this approach because of that. Mainly because of the situation that you can see here. The possibility of extruding here wouldn't go with this anterior teeth, anterior upper teeth, very low because in this case, patient had this negative exposure of anterior tips of incisors. So yes, good for the patient to extrude anterior teeth. We could do that space closure, space retracting anterior teeth with extraction or just using elastics for that. And we have some differences when we do this, when we choose one or other option for that. I'm going to explain it later. And in this case, it was good to do the extrusion because of that. So if you compare with this other situation in which you had this anterior open bite, but with this gingival exposure, excessive gingival exposure of upper teeth, it would be very bad, actually disastrous if you did that in this case, in this kind of patient. So let's do this. Let's understand what happened between those two photos. I usually say that we in social media, we usually see just before and after, but we need to see in between. This photo here before treatment, before we started the treatment, and then after that, what happened in between. And that's what I'm going to talk about now. This is patient's occlusion. As you can see, the final stage of the second transitory period of a mixed dentition. And in this case, we had this this peg-shaped upper lateral incisors. So we needed to deal with that also. In this case, this patient had this face, a good profile, a good exposure, a good symmetry of the face, there's a symmetry between those two sides, and the volume of the face and the three-thirds of the face were very symmetric, very good. And in the situation, we could do this also because of this facial pattern. So as you can see here, we have this anterior open bite. The midlines were very correct in relation to the face. The profile of this patient had this good positioning of upper and lower jaws. So we could deal with that, keeping that as it was. And we have this good profile. As you can see, the importance of facial analysis, the diagnosis is the most important thing for us. So we keep doing the diagnosis before everything. Before thinking about biomechanics or anything, we deal with the diagnosis. Because from there, from the diagnosis, from those points that I consider important, I'm gonna do this treatment planning. And from there, I can treat my patients, keeping in mind that I will or won't change the profile, change the smile, change something that for this case or specific case is good, and we'll have a good outcome for that. So Let's move on. Good uh, uh, volume in this part of the face, in the zygomatic area. This nasolabial angle is very closed, with very acute angle, meaning we could do the extraction, we could do the retraction and everything, but this patient wouldn't go with extraction because her parents said that it was not a good option for her. So we respected that, and then we went to the second possibility. In my experience, if I would choose what to do in this patient here, I would go with extraction. This was the first option that we gave her, but she wouldn't go with this treatment planning, and we respect that. So we have a second treatment planning, which is just closing the space, closing the bite using elastics without extraction. But if I were to do if I was the one to do to choose what to do, I would go with extraction rather than go with just the elastics. It would be easier. We would correct the posterior, anterior, this anterior segment, and we would open a little bit of this nasolabial angle. As you can see, we keep going with our analysis of the profile, and here is this image that I consider very important for us in order to understand what to do. So in this case, we go with the facial analysis. We do together the facial analysis with the cephalometric analysis, so we can understand things about patient's face. And here we have a good profile. We have a good and very horizontal pattern. Anterior teeth, they were protruded. That's another thing that calls me the attention about what to do. Extraction here would be better for her, would be easier to close the open bite and to solve that protrusion of anterior teeth. So yes, here we have the occlusion, analysis of the occlusion, and here we start our treatment with leveling and aligning, opening the space for the canine in this side here. And we see now that before initiating the treatment, before starting the treatment, we did the resin here, the composites. Of course, it's something that is transitory. It's not a permanent composite, but something that allows us to put the right bracket in position, to put the lateral incisor bracket in position without going with more inclination of anterior teeth because of the difference between the thickness of this tooth, specific tooth, lateral incisor, and the central incisor and canine. So we opt to do this before doing the treatment, meaning transitory, temporary crowns, temporary composites, and opening the space. This patient started using elastics, wearing elastics in this face. We use the elastic from here on. So we had this triangular elastic, the posterior segment, going from here, premolars to the upper premolar. Okay, so same thing here. And in this case, it was possible to put the elastic in this position because this bracket has these slots that they are very protrusive. So it was possible to put the elastic here. 1/8 elastic, heavy elastic position in this shape. Premolars, lower premolars, and upper premolar. So from here on, elastics, I'm opening the space here. This case actually was treated in one of our courses by one of our students, so by my orientation, and we open the space. We are opening here and using the elastics here to do a couple. A clinical couple, actually. It's not a real couple because we are not measuring the force, like being very strict about the force, the magnitude of the force. Now we have another phase of the treatment, also opening the space, and then now using elastics for closing the bite. So this patient was very compliant, and she wore the elastic a lot, as you can see, and we kept going on. Now we have another elastic, as you can see, a class 3 elastic to go uh, distal with anterior segment in the lower arch. And here we went on vertical elastics again after correcting the class 3. And here you can see a photo with the elastics in position. Sometimes it's very difficult for us to control all the photographs that we want our students to take pictures during the treatment, but now as you can see, we can see the elastics in position, and now we have two sets of elastics in each side, two 1/8 heavy elastics in this triangular shape, so closing the bite because we are now keeping position of posterior, and the leveling and aligning arches are doing the job for us, meaning going down with anterior teeth, and you can see the same or the shape of the arches now in this phase. And as you can see in this phase, we are having now a better position of anterior teeth. I again call your attention about this topic here. If we did the extraction in this case, probably the anterior segment will show more or a little bit more of gingival exposure here, and the smile arch would be better and easier to achieve. But again, respecting patients' and parents' options, we need to do that, okay? So here we go again with the extrusion. And just one point, very important point for us to understand here. When we close the bite, you can't remove the elastics. It's not that automatic. You do the elastics, close the bite, and you wait at least 3 months so you can have stability of the case, because you have two sets of renewal of the periodontal fibers of the ligament, periodontal ligament, and we have the growth of the bone. So we know that after closing the bite, the bone is going to take at least 3 months to grow around surrounding the roots, and we have two renewals of the periodontal ligament fibers, meaning now we have more stability. So we need to wait. Don't remove the elastics, otherwise you're going to have a very fast relapse. Don't do that. Wait, just wait a little more time, 3 months, and you can decrease the amount of time of wearing the elastic. You can change the regime of wearing the elastic for just using it, wearing it for 12 hours a day maximum. Don't need more than that. 10 hours is good, between 10 and 12 hours for three months, okay? So as you can see, before removing the appliance, we need those 3 months, and you see here that we have a good positioning of posterior teeth, good intercruspation, spacing, the bite being closed, and after that, we referred this patient to the cosmetic dentistry. So you can see here the beauty of the cosmetic dentistry after that, and you can see the smile, good smile. So it was a good treatment planning with the extrusion of anterior teeth, because we started with the diagnosis, meaning we understood our patient's face, and we dealt with those conditions that allowed us to do the extrusion, meaning we have this negative exposure of anterior teeth in a rest lip position, so we could do the extrusion, and during smile, this patient didn't show half of the crown. So after that, as you can see, now we have a good exposure of anterior teeth again. Another option here could be the extraction of 4 premolars, and I would opt to do the extraction of 4 first bicusps for this case, to do the retraction, and during the retraction, controlling the center of rotation of the movement, positioning the center of rotation close to patient's anterior teeth apex. We could do this space closure with more extrusion, and in my opinion, a better smile arc. But it's good. In this case, it was a good finishing. And here you see the outcome of this treatment planning. So, first case to show to you, you can do that. We can use elastics for closing the anterior open bite, but we need to start with the diagnosis. If the diagnosis tells us it is possible, it won't decrease the beauty, it won't jeopardize the beauty of the smile, we can go for it. In this case, it was very good. So, did you like it? Hope you liked. I'm sure you're going to enjoy the other classes about the same topic, anterior open bite, and I will always focus in the same points, which are diagnosis, treatment planning, and doing the right biomechanics for that. So, please give me a like, subscribe to my channel, and I see you soon.